If your baby is doing this, it's time to head to the emergency department. These are retractions, the skin sucking in between the ribs there, and that's a sign of respiratory distress. If you take a little peek at his tummy here, he's actually using some extra muscles to breathe, and he's breathing pretty fast. That's tachypnea. Same little guy. You can see he's sucking in here between the rib cage and the tummy. This is some belly breathing and some retractions here as well. He's about a year old, and he has something called bronchiolitis. We started with some suctioning, but he did eventually need some respiratory support. This little guy is 3 months old. He also has bronchiolitis, and you can really see here just under that rib cage just how deep he's pulling, using all of those extra muscles to try to breathe. This is respiratory distress, and he's also breathing really fast. Look how many times a minute he's breathing. Same little guy after suctioning. This is head bobbing that he's doing here, and this is a sign that he's still working kind of hard to breathe. So we got him started on high flow nasal cannula or Vapotherm. This is a little 8-month-old, and he has some mild increased work of breathing, not as obvious as the other guys, but some retractions that you can see over here. And then he is tugging here, but he's also happy. We call kids with bronchiolitis happy wheezers. Sometimes it's hard to know if your kiddo's sick enough to go to the doctor or if they need to go to the emergency department, but if they're showing signs of respiratory distress, they're starting to get dehydrated or have altered mental status, it's time to head to the emergency department.